I'm excited to be here today. I want to pay my respects to the Gadigal people of the Eora Nation and for their amazing custodianship of this country, and so much I think we each gain from that trusteeship that has been exercised in this community. And in some ways I think a lot of what we do in social innovation is building on that legacy. It's particularly exciting and stimulating for me to be here today on this occasion because this is one of the few occasions where I get to be the service user as well as the service provider. I have secondary bowel cancer in my liver and my lungs. It's not operable, and so I have a terminal diagnosis. I'm on some very good drugs at the moment called cetuximab that has reduced my tumours by somewhere between 1/2 and 2/3 since Christmas time. So something there is working, and I'm much encouraged because I'm pretty keen to keep doing the kind of stuff I've been doing over the last few years. But I'm also very interested in seeing this palliative care space improve, and very impressed that the Cancer Council has taken this issue up. I was here just a few months ago for an advocacy training course that the Cancer Council was running in this very room. And Bernie Banton's legacy, I think, is another we can hold on to with great pride in this country. But for me, palliative care has to improve. I happen to have a stepdaughter who's a palliative care doctor and a brother who's a palliative care social worker. So I'm learning quite a lot about how the system works and doesn't work for people just like me. And one of the issues for me that is particularly, I guess, a concern and a question is the challenge about how to connect the informal caring sector and the formal healthcare and palliative care systems so that they work seamlessly for people who need the service. I have my support network, my various members of my family here today too, because I see this as very important kind of pre-education and preparation for the caring that I'm going to need sometime, I'm not sure exactly when. So I want to share with you something about social innovation and why I think it is such a critical priority for this nation. First of all, I think it might help if I attempt to define it. We're talking about the implementation, not just the ideas. There's lots of folks who have ideas, but putting those ideas into action is the critical issue for me, of new solutions to significant social problems, needs or opportunities that have principally a social rather than a commercial purpose. I'm not saying commercial purposes aren't good things, and it drives a lot of the improvements our society has seen over recent decades, but principally social innovation is interested in the social outcome and the social driver rather than the commercial one, although plenty of social purposes end up being quite good and productive commercially. Next is that we're looking at solving the underlying need rather than just alleviating symptoms. I don't know about you, but in much of my work over many years in the social change business, I find we struggle and work our guts out dealing with symptoms, and then we realise that we really weren't dealing with the real issue at the core, the problem, the thing that was really underlying. And in a way, peeling back the onion is part of what you've got to do in this business to really find where the problem is. And for so many of our social problems in our globe today, the problems are really complex. Problem overlays problem and is intertangled with other problems and very often it's tough to find what the real problem is. Sometimes there's a term called a wicked problem that I don't know is familiar to you, but the idea around a wicked problem is that very often when you try and tackle it in the logical way that governments and business and all kinds of other folks, logical thinkers who are good at logical problem solving usually do, you actually make the problem worse, not better. And that's the challenge. Often we don't really understand the problem we're trying to deal with until we've actually found a solution that works. That helps us understand the problem in a way that few other things do. Lastly, we're concerned that our solutions are sustainable solutions. Sustainable economically, sustainable socially, and sustainable environmentally. I've just put a list off the top of my head of what some of the priority areas for action are in our global community. Climate change has got to be somewhere on the list. Poverty and social exclusion. Chronic illness. I don't know how many of you realise how much the burden of illness in our society is moving from acute illness to chronic illness. Unfortunately, the health system we've designed was designed for acute illnesses. The hospital system and much of the health system needs to radically change if it's going to respond to the growing priority in healthcare in our country. We have an ageing population, and obviously those two issues, chronic illness and ageing populations, are often interlinked. The challenge of knowledge sharing and creating knowledge is one that's very important in our society today. Wikipedia is one social innovation that responds to that challenge. Community building, democracy, crime and punishment. We know how much money is being wasted in our crime and punishment systems. We know prisons don't work, but we continue to spend massive amounts of our taxpayers' money. And as a taxpayer, that really bothers me. That my money, I know, is being poured down the toilet in very large bucketfuls because some people think that locking people up is a way of solving the crime and punishment problem. We have to get better and smarter than that. Terrorism is another issue. I don't pretend to be an expert on any of these issues, but they are some of the ones, and I'm sure you could probably add a dozen to that list. When we think about social innovation, I guess how we tackle the problem is as important as the fact that we tackle it. And good practice in social innovation, and this is an emerging field in the world today. There are a whole range of groups developing around the world working and using the term social innovation as their tagline, their purpose as an organisation, but it's very much an emerging field. So you know, what I tell you today, in 12 months' time, you could well hear a very different answer. But in terms of what people think is good practice in social innovation today, first of all, it's something that values diversity. The idea that the collision of the unfamiliar often is where some of the best solutions emerge, when people from different disciplines, who maybe don't even like to talk to each other because they see each other as at opposite ends of the pole, or you know, as the great unwashed, or whatever it might be, getting that kind of diversity together is critical. Engaging consumers and users of service and other stakeholders for whom there is a real interest in solving the problem is critical. Often also identifying where the hostility and the opposition is going to come from becomes quite important too, and ideally turning opponents into allies can be one of the most important tasks in getting change that sticks. Careful problem definition and framing. You know, how we define a problem matters a great deal in terms of how we're likely to want to solve it. You know, so if you see drug abuse as a crime and punishment issue, then you're probably going to want to attack it with a crime and punishment solution. If you see it as a health problem, then you're going to want to tackle it with health solutions. If you see it as a community problem about poverty and social exclusion, you're going to tackle it in a way that uses the tools of that sector. And so how we define the problem often is very important. I know we were talking about end-of-life issues as something we don't want to focus around problems. I think it's important in social innovation that we often do talk about problems and face them quite really. I think also we need to recognise where are the assets, where are the capabilities, where are the signs of hope that can be built on. And I think when Charles comes later on this afternoon, he'll share something about looking at where great stuff is happening at the margins of communities very often. You get remarkable insights into how problems can be dealt with. You know, it's why I think we have so much to learn from Kerala about palliative care in this country. Because actually, when you don't have a lot of money to throw around and you find a solution to a problem, you often find a much better solution than when money isn't nearly as big an issue. Knowledge sharing and openness. Open innovation, for those of you who know something about the innovation space, is something that's had a lot of attention, particularly in the IT sector in recent years. But openness is a critical ingredient very often too. Rather than people hanging on to their private bit of information and wanting to extract the maximum dollar value out of it, a willingness to share information and share learning and recognise often that we'll get a better outcome both financially and socially if we are much more open about the way we share information. Understanding and acknowledging complexity, I've already talked about. The thoughtful use of technology. There aren't too many technology types who pretend that technology is the solution. But very often I think technology can have extraordinary contribution to helping us achieve an affordable solution and an effective solution that reaches large numbers of people rapidly. Drawing on international experience, you know, we talk about globalisation, but in the social sector in this country, I think we're remarkably isolationist in our thinking. We don't very often go and look around the world to find how have people tackled this problem in other parts of the world, in Chile, in China, in Vietnam. It's amazing what solutions you will find in other parts of the world when you look. And too often I think our politicians go to the UK or go to the US and bring a solution back to Australia that they haven't really examined all that carefully. It just seems like a sexy idea to introduce at the next election. And very often I don't think we get the best solution in this country. Intervention at scale. This is another issue. Often people like to do things in small and intimate and manageable ways at a community kind of scale. And I want to honour and acknowledge that approach. However, if we have a problem that's affecting the globe, that's affecting all of us, whether it be ageing or climate change, you name it. These are problems that the world as a whole is struggling with. We have to tackle those kind of problems on a global as well as on a local basis, and we need scale. From my point of view, it's wonderful if a small community finds a solution to a problem that it can manage at a community level. But if 99% of the country misses out on that solution, because it hasn't been diffused or replicated in some way so that we don't have the benefit of it, and it would have worked for us too, then I think we've only really captured a fraction of the available benefits that we need together. Another issue that's really important is that we have evidence of impact. So really, social innovation has got to be, for it to be effective and impactful, it has to be evidence-based. We can't afford people just having, being good salespeople who sell their great solution and convince lots of folks. I mean, you know, in the health sector and particularly in cancer, it seems to me that we have hundreds of organisations in this country, each beating their drum. As a donor, I find it extremely difficult to know which of those many organisations will use my contribution in the most effective way. I don't find it very easy to find my way, even though as a cancer sufferer I have a very real interest in investing my dollar wisely. And I find it extremely difficult to understand the differences between the hundreds of cancer organisations, each asking me for my dollar and each believing that my investment with them is going to achieve a better return. But I don't see a lot of data that helps me understand where that dollar is best invested. And to me, this is one of the issues we have to deal with better. And cost effectiveness matters. Recently from the UK, I've become aware of a study called Radical Efficiency. I don't know if you know, but the UK's economy is in pretty bad shape. And the new coalition government that's been elected is taking quite a massive axe to the public sector, and most government programs are suffering quite massive cost reductions. And what's been interesting is this study on radical efficiency has been looking at those organisations that have been experiencing around the world. So they're not just looking at the UK, they're looking around the world at organisations that have had a 30% reduction in cost minimum, and at the same time have been able to improve the quality of their service and the reach of their service significantly, whilst going through a 30% cost reduction. Now that's pretty significant. I consider that is something we all need to study and understand. As a taxpayer, I don't want to waste my money. You know, in palliative care, the thought that an awful lot of people are in intensive care for the final weeks of their life at enormous cost to me as a taxpayer, when that's not where they want to be, and it's not where they're going to get the best service either, I find extremely distressing. You know, if that's the way to end your life and everybody's paying for it, something is wrong. I don't know about you, but I think something is wrong and something we have to do something about. So those are some of the good practice principles. That's not an exhaustive list. There are some organisations that I think are doing some interesting work in this field that I would like to just showcase for a moment. This is an interesting organisation. I don't know if you've heard of an organisation called Patients Like Me. It's a website. It's a commercial service, but it was set up really with a social change driver. And people with a whole range of different illnesses can log on, register with this website, and put their information in. They can give themselves a nom de plume so that their name isn't identifiable. But this website is based around the idea of openness and forget the privacy principle. Let's share our information so we can learn stuff that will be useful to us. And it's extraordinary. This is patient-driven research. And you will find, whether it's bipolar disorder or various forms of rare disease, there's an extraordinary range of people who are registering themselves around these diseases. I have registered on this website. And you can get all kinds of information. You can also use it to track your own symptoms and side effects from the various forms of chemotherapy I receive. I'm learning quite a lot. And in fact, drug companies are now buying the data from this website, and that's part of what makes it financially viable, are buying the data because they're getting more useful information than they are, in many cases, from their own research. They're getting more useful information from what patients are telling them directly about their side effects and symptoms. And it's quite interesting. You might find 10 people on this website will try some complementary therapy alongside a more mainstream pharmaceutical therapy, and they are looking at how each other is going, and then suddenly you'll start to see good results coming, and a whole bunch of other people will join this community and will begin participating in that same treatment regime. Now, I assume they're keeping their medical practitioners up to date with what they're doing here, but it's a very interesting patient-driven community. And let me tell you, there's a lot of folks with money who've invested in this. So let me tell you, they're doing all the risk management that needs to be done to make sure that they're not causing people to do things that they shouldn't. But it's extraordinary when you put patients in the driver's seat, what comes out of it. Another website that I think is quite interesting is the Institute for Healthcare Improvement in the US. This organisation took up the responsibility to reduce needless deaths in hospital by 100,000, and I think they took 18 months to get there, by getting hospitals to voluntarily choose to participate in this exercise and finding a champion in each hospital who would drive the campaign within their own hospital, and by doing about 4 or 5 very basic things. Washing hands on a regular and reliable basis so that infection wasn't being passed on. Sitting people partially upright who are in danger of catching pneumonia. A few very basic things like that. They saved 100,000 deaths across hospitals in the US. They've now identified where the next, I think it's 500,000 lives are going to be saved, and they've got a campaign going with that. They have a whole series of other resources, mostly it's hospital focused, but they're really talking system-wide change, and some of it quite radical. And they've got a mapping system and so on where you can actually track your organisation's progress in this area. Patient Opinion is another interesting website from the UK. This was started by a GP, and basically it's a website where you can go in and tell your story, good or bad, of your experience of the healthcare system. It's designed to drive improvement. So this is not about beating up on people. This is not about law cases. This is actually about helping identify areas for improvement. And again, the NHS is buying the data from Patient Opinion to enable them to fix the problem. And very often, for example, here we go, this one here, they put a blanket over her and constantly made sure she was comfortable. Stories that haven't yet been read, stories that are heard, stories that have a response, and I think further down on this site, stories where action has been taken by the hospital that identified there were some things they needed to fix. Nearly 30,000 people have told their stories. 1,100 staff are listening, and 131 stories have led to change. So, you know, this is quite an interesting tool for social innovation. Charles, who's coming to speak to us later, is a partner in an organisation called Participle, which is a consulting business, a consulting firm that works on social change issues and public services. Again, very interesting, and the study that Kerry and others have talked about were undertaken by Participle. I think Public is the other organisation I wanted to mention. It's also a design firm. So this is a firm not using social services or healthcare or whatever skills, but using design skills to tackle social change, and again, very often involving consumers of the service. So I've seen some video and other material where they've actually worked with patients, cancer patients, to redesign the way the cancer ward works for them. And it's extraordinary the moments of truth that people experience in their experience of the healthcare system. You know, when you go in and somebody either says something or does something or puts you somewhere which doesn't really work. I know how much time I waste in Prince Alfred Hospital as a patient on a regular basis, because I think their time management system needs some major improvement. I don't know if others of you have shared the same experience, but to me, you know, I feel like I'm there as their captive at times, and that my day belongs to them. I actually run quite a busy consulting business and I have to keep working. So I bring my laptop and my mobile phone and I keep going, but really often it's a very unproductive workplace. And I would like to make that a much more productive experience for me and for them. And I think they could find some very good ways. So Think Public actually works with patients very often to help redesign that patient experience. So and using skills from the design profession has brought some extraordinary transformations to that patient experience. So those are some of the things that I just wanted to kind of give you a walk through the field of social innovation. It's really just a potted tour. I hope it's been useful. For me, some critical issues that we face, particularly as we bring this back to palliative care, are how do we reduce the disconnect between the professional healthcare system and the community or alternative care sector? I don't know what you want to call it. That to me is a pretty significant issue. I think another issue is how do we reduce the waste, the unnecessary waste of people being in forms of care that aren't really the most suitable for their needs, that are costing us as taxpayers money we shouldn't be having to spend. We know the healthcare dollar is under enormous strain in this day and age, and I think we can find some better ways to deal with it than so far we have. So I hope that kind of encourages you to think innovation. I believe that if we're to get the kind of service systems that we need in this day and age with a changing world, we have a series of major social challenges bearing down on us like a freight train as a country and as a globe, and we are not equipped to deal with them. We don't have the systems or the services in place that are going to deal with those problems. And we need the skills and capabilities of social innovation, and we need for every citizen, every single citizen, to believe that it's my responsibility, not the government over there or business or the not-for-profit sector someplace else. It's not their problem to fix it, it's mine, and I need to do it for myself and for the generation that comes after me. I want to leave this country, this nation, and this world in better shape than it was before I arrived. At the moment, I'm not sure that is being achieved. And I think that's the task that we as citizens need to accept together. Thank you.